So this is the not failure of as a staff nurses. This is not your failure. So what you have to do, you have to tell your supervisors immediately, and they should make a plan. They should make the strategies according to that. Means if you are facing extra work pressure, extra burden, so they have something. They have some helping hands. So we can give the medication on time, and in that these types of errors should not happen. So what are the causes of medication administrations here? So in that we will see the main thing, three things. The first one is structure. When we are talking about structure, that means how many staff is there. So what is the current scenario in the normal ward? How many patients we have to be assigned? 7, 8, 18, 8. In ICU? So that's why we have to learn about the structure. Means as per the wards, as per your emergency, as per the ICU, the staffing norms is different, right? So what is the standard staffing norms? You will see, we will see here the 5 main things. The staffing means if we work out on staffing, means we have the appropriate ratio of the staffing pattern. So what will happen? The work pressure will not be increased. The second thing is fatigue. So you have seen there are so many researches going to happen. Nurses fatigue. Right? What is that? Workload fatigue. Have you seen? So if the staffing pattern should be normal, what will happen? The workload fatigue will not be there. Means I will not be exhausted. I will not burn out with the workload. Right? Suppose as a staff nurse you come here without breakfast, you come to the ward, then there is a work fatigue there. So you are already lethargy, less energy, dull energy. In that scenario, which type of care you are going to provide? It should be low, right? So fatigue. Third one is distraction. What is that? Means distractions. Which type of distraction we are talking? Distraction happens कैसे? That's why due to preventing fatigue, we used to tell you, you have come with full stomach, right? That means you will be energetic. So the same energy level you will give to your patients. Okay, suppose if I am asking you, how are you? How are you? Answer me. How are you? And now I am saying, how are you? Both the things is different, right? So I will match the same energy. As a patient, if suppose I am not feeling better also, you will say, okay, just smile, okay. So what will happen? The person will at least put some force, right? The third one is distraction. Distractions कैसे? So you have seen in the ward, we are multitasking. We used to enter the data in laptop, computer. At the same time, we are sending the lab investigation, diagnostic purpose. The patient is coming to the ward. The patient is shifted to the ward. Patient is going for CT scan, MRI. So these are the distraction, and due to prevent these distraction, what we have the different staffs which they can help in different procedures. For example, we have to assign 2 staff nurses to enter this data in the electronic health record, 2 staff nurses who is going to do other documentation works, and other GRD staffs and other staffs what they can do, They can shift to the patients and they can send to the patient to the other wards. So this type of distraction will happen less there. The fourth one is handwriting. So you have seen, especially in medical fields, the handwriting has a major role. So at handwriting and abbreviations. So if you will see there is any illegal prescriptions of medications and you are not clear about this is unclear abbreviations also there. So just speak up and ask for clear and complete prescriptions. Don't assume anything by yourself. So awareness of them allow us to extra cautious, and nurse leaders are to plan the strategies to address these types of errors. Second thing is process layer. So when we are in a system, after the structure we are going to handle the process. So what is the process related factors means how we handle the medications. In that you will see the first thing is communication. So as a nurse we have seen what are the qualities of a nurse. What are the qualities of a nurse? You white shirt. Any one quality?
And she should be enough confident to perform her role and task, and having a thorough knowledge about the task she is going to perform near the healthcare department.
Very good. So you have seen the nurse should be cheerful. The nurse should have always smile in their face, right? The communication should be like, communication should be clear and soft, right? So what will happen if the poor communication will be there? Might be there is a problem with the handover. So I am not giving to give the handover to another staff with a proper sentence. That means my communication was poor there. What will happen? Another person will not understand maybe what you want to say in the same terms. So whenever we are giving the handover, when we are giving some notes, we have to clear that and proper communication should be there. The second thing is verbal and telephonic orders. So if verbal orders are not very clearly understood, they can lead to the wrong medication administration. We can see it is always a safe practice to get the doctor on duty. Means when we are having some telephonic orders, so we should reserve for emergency situations only. Usually what type of orders we have to take? The written orders, right? But in some emergencies we used to have verbal or telephonic order, but it should be very clear from the person and it should be very clear to the person who is receiving. And if you have any doubt, just clarify with the emergency doctor and the doctor who is on your ward. Next we will see read back or repeat back. Do you heard these terms? No. So what is a read back and repeat back means? This is a very simple and powerful tools is repeating back or reading back a medication order to confirm the accuracy. For example, you had a patient from emergency to first ward and they said we are giving you have to give augmentin 625 mg right now. So just read that augmentin 625 mg. They will assure yes. So that's why they mentions read back and immediately we have to repeat back. So if they will say no, this is not 625 mg, this is 1 mg. That means our medication error might be happen which we have prevented just now. The next is call out technique. So what is call out technique? So saying medication details loudly, ensure the whole team is aware and cross check the information. So for example, in your ward there is 4 staff nurses and someone told you, okay, 625 or 2625 mg you have to give to the patients. Just speak loudly, 625 mg, okay. So that means undoubtedly या unwillingly जो बाकी staff nurses था उन्होंने भी क्या किया, सुना. If they know the correct one, okay, this is the right one, so what they will do, they will